COVID-19 recovery typically takes a few weeks. Post-COVID recovery. Some patients start to experience a list of common symptoms from the disease. This phenomenon is called post-COVID syndrome, and the patients are long haulers. These symptoms can last up to at least 6 months. Older people usually experience it, although younger people have also felt unwell after 4 weeks of being diagnosed. For this video, we will be discussing the 6 common symptoms of post-COVID syndrome. Number 6. Brain fog. Brain fog is difficulty thinking or concentrating. COVID takes away a vital function of the human being. Once you have spent weeks trying to recover and struggle with doing anything besides sleeping in pain, your system begins to have difficulty concentrating on tasks. Sometimes a rush of ideas is suddenly clouded with attention deficiency and leaves you not remembering anything. Many people went back to work after their infections and realized that they could not perform for a long time. It takes weeks, sometimes and months in other cases, to get back on their grind. Comment a thumb up if you ever had brain fog post-COVID recovery. When we talk about multi-organ damage, you will understand that people endure brain damage as part of their post-COVID syndrome beyond brain fogs. Other effects like lung, skin, and heart damage are coming up later in the video. Number 5. Change in smell and taste. The first few weeks of being diagnosed with COVID, you will not smell or taste anything. To illustrate, you could be eating a burrito and ice cream, and they will taste the same to you. Cold or hot is the only sensation you can distinguish when you eat food. Everything will smell the same, from your caramel coffee to your dirty laundry. When you recover, you could still experience challenges properly smelling or tasting. The condition will not be permanent, but you can start having reduced sensations with your senses. Number 4. Fever and dizziness. When you stand, the headaches, stomach pains, and dizziness can stay for as long as 4 more weeks after you have recovered. The sudden chills and lack of balance are tied to post-COVID conditions. Painkillers and eating a healthy, balanced diet could help with these symptoms. Old symptoms that do not go immediately are often best treated with the same medication from when you were diagnosed. Dizziness and fever are not the only old symptoms that stay. There are chances that one might experience respiratory challenges like shortness of breath even after recovering from COVID. We will be discussing more of that as we go ahead in the video. Number 3. Joint and muscle pain. Before we get into the joints and muscles, please take some time to subscribe to our channel for more videos on health and diets for a better lifestyle. Now back to the pain in your knees. Joint and muscle pain can lead to sleep problems and prevent you from working. The kind of diet you eat must include a lot of protein to build up the wear and tear around your joints. Adding fortified supplements can also help you if you struggle to eat due to the pain. Additionally, this is one of the few times where sleeping it off does not help. You have to solve it because not all the rest in the world can help you. Number 2. Difficulty breathing. Difficulty breathing is the primary condition of COVID since it is a respiratory illness. Many people have shortness of breath and struggle to walk up and down a staircase weeks after recovering from COVID. Some singers, including indie artist Tommy W.A., have shared on their social media that they could no longer hold a note for long after recovering from COVID. The lungs will need extra time to repair and rejuvenate before getting back to their regular duties. Attempting to do activities that require frequent breathing leaves people with chest pains. Advice for people facing this is to ease down on tiring activities if they are looking at getting back to fully breathing without difficulties soon. Number 1. Organ damage. Severe COVID-19 illness has also led to some people experiencing multi-organ effects. There have been cases where people with underlying medical conditions have had their primary medical progress disoriented by the impact of COVID. The multi-organ effects can affect every body system. The heart, lung, brain, and skin can be damaged by post-COVID recovery. In addition, there is inflammation and tissue damage caused by the immune system mistakenly attacking healthy cells. Children have also been reported to experience the multisystem inflammatory syndrome. This is a condition where different body parts suddenly become inflamed. All these organ functions are essential for the well-being of an individual, and so having them affected by the virus is one of the scariest parts of the entire pandemic. Can you imagine not having any organ issues and then recovering from COVID to learn that you have to battle lung damage for the rest of your life? It could be devastating. Yet that is so many people's stories, especially since COVID is a respiratory disease. To prevent these symptoms, one needs to avoid catching the COVID-19 illness. Vaccinations and booster shots are available for all those who are eligible. If you have been considering a post-COVID diet plan, we have a video that might be helpful to you, and it is called How to Eat Healthy After COVID Recovery.